Coming into this pandemic, Ontario faced a critical shortage of nurses, PSWs, and other healthcare workers. The former Liberal government had frozen hospital budgets and cut 1,600 nursing positions, and many of those positions are part-time, temporary, precarious positions. And the Conservatives came into power in 2018, and they did nothing to improve this position. In fact, they passed Bill 124 that froze wages, nurses' wages and healthcare workers' wages at 1%, which is 3% below inflation. So the long and short of this is that we came into this pandemic with a shortage of 16,000 healthcare workers in Ontario. And there's a gender component to this issue. 92% of Ontario's nurses are female, and 86% of the orderlies, nurses' aides, and PSWs are female. And for 15 years, the Liberals and Conservatives, those governments have been fighting in the courts against providing pay equity for nurses. But last week, the Supreme Court ruled that nurses do in fact deserve pay equity with other professionals in this province. Our nurses and healthcare workers have worked incredibly long hours to save lives during the pandemic. And now that the pandemic is waning, there is a backlog of 16 million medical procedures in Ontario. And these include cancer screenings and treatments. They include 90,000 cataract surgeries and 3,000 coronary bypass surgeries. The Ontario Nurses Association CEO, Doris Greenspun, writes that the procedures and surgeries are being delayed because we do not have enough nurses to care for patients. And Dana Karamolu, a nurse in my riding, wrote, I have 21 years of nursing experience, and I see the nursing profession losing valuable senior nurses. Bill 124 that froze pay below inflation further deflates us nurses who are barely hanging on during this exhausting pandemic. And another nurse in my riding wrote, throughout the past 19 months of this pandemic, healthcare workers, especially nurses across Ontario, have selflessly cared for the citizens of Ontario while confronting fears for their own health and safety and that of their loved ones. They are exhausted. They are burnt out. The Science Table reports that 43% of nurses are considering leaving the profession. I am asking that all members of this House support the motion, the healthcare workers who have saved lives through the pandemic and who are helping to clear the medical professional procedure backlog. Please vote for the NDP motion to provide full-time permanent positions, to provide pay equity, and to launch a massive campaign to retain, to recruit, and to train healthcare workers that we need in this province. Thank you.